Hey guys! Hello, good afternoon. It's Dr. Dawn, your board certified OBGYN. I am here to help young women and girls reach their next best. So, welcome again. It's here. It's a new year. Happy New Year. And I'm excited to be here and share more information with you. I'm going to have these conversations ongoing during the year. So I started with contraception, which is basically birth control options, because I feel that's one of the main things that women, especially young women, are coming to talk to me about. So that's why I started with contraception. And we're going to move on and go and do more things as we go along. So again, Dr. Dawn, your board certified OBGYN. If you have a moment, please like me on Twitter and Instagram and like my Facebook page because I'm going to continue to do these. Hey, Dr. Tamika, happy to see you guys. So we're going to get started. So again, Dr. Dawn, conversations on contraception, birth control options. We've had these conversations numerous times. And so what today is going to be is like a summary of everything that I've gone through so that you can really look at this video later or share it with people that you think it'll be important to know about. And they'll be able to get all the information. More details will be on the other videos, but we will go through everything. Hey, Ivy, we're going to talk about the Depo-Provera shot. So stay tuned, bring more friends along, and forward them to this email. So the first thing I'm going to talk about is my favorite birth control option. You guys know I love the IUD. The IUD has been around for a little bit. It's getting a little more popular, and if you come into my office to see me, I'm going to talk to you about it. So basically, the IUD is a small device. It's called an intrauterine device. It's maybe this big, that small. It has a little tail or string that comes on the end of it. The doctor or the provider puts it in your side, your uterus here in the office. And there are two types. It has hormone, which is progesterone, or non-hormonal, and you can leave it in anywhere from 3, 5, 10 years. Spermicidal, so that it basically creates an environment where the sperm can't survive. And also, if you have the hormonal one, which is the Mirena or Skylar, it thickens that cervical mucus, so it really makes it hard for the sperm to get up where the egg is or ovum is there in the first place. So efficacy, or how well it keeps you from not being pregnant, 99%, which is as best as you're going to get, ladies. So IUD is something you need to think about. It is what we call long-term, but it doesn't have to be long-term. You can place it 1 month, get it taken out a month later, a year later, or hopefully 10 years, depending on what you need. Side effects, mild cramping. Some people get more cramping with their periods first couple of months. After that, you should be okay. And the other thing with the IUD, especially with the hormone, it decreases your bleeding. So if you're a lady that has heavy bleeding, this is an option for you as well because it decreases that bleeding to where you're just spotting. So that's the IUD. The next category I'm going to talk about briefly are the hormonal pills, ring, patch, because they really fall in the same category. The birth control pill we kind of familiar about. The vaginal ring is a little bit newer in terms of how long they've all been out. And the patch and the Nuva ring, or the birth control ring, they've come out together. So basically, you have estrogen and progesterone. Those are hormones that are normally in your body. But these medicines manipulate them so that you don't ovulate. And if you don't ovulate, you really shouldn't be able to get pregnant. And that's basically how all of those work. The birth control pill you're going to take every day. The vaginal ring you're going to leave in for 3 weeks at a time. And the patch you're going to leave on for a week at a time. And for the ring and the patch, the ring you're going to leave in 3 weeks, take out, put it back in after a week with it out, not being in your vagina. And the patch you're going to switch it a week at a time. And that 4th week, you're not going to do anything. With the pill, you take a pill every day. It's the only thing is that last week are what we call placebo pills or sugar pills. So they don't have any medicine in them, but we still want our ladies to take those pills just to keep you remembering to take a pill. All right? Side effects that a lot of ladies will notice: nausea, breast tenderness, little bloating. Bloating does not mean 10 pounds. Bloating means a pound or two. Okay? So if you're doing more than that, a pound or two, is probably not because of the pill. All right? Now, some women will notice that their sex drive decreases a little bit. And that's another thing that you want to pay attention to. If you get those side effects, let your person know. Let your doctor, your provider, your midwife, your nurse practitioner, let them know. Because there are a lot of other options that we try. Sometimes one pill or type of medicine will work better for you than another. So let us know so that we can switch it and make sure that you're on something that will help you. So the birth control pill, vaginal ring, and the patch, they also shorten your cycle that you're on. So if you have 7 days, it should be about 3 to 4 days. Should be less heavy as well. So ladies that have heavy cycles, if they don't do the IUD, the birth control pill could be an option for you. All right. So those three kind of in the same category. Then we have the injectables in terms of the shot and in terms of other devices. So those are all the medicine or the hormone that we call progesterone. Very high dose, higher than what we normally see in your body. So we are going to, hey, Cousin Cherie, I'm sorry, I have to say hi to fam. We give you those in a high dose, and it also stops you from ovulating. So the Depo-Provera is the injectable that I'm talking about, and I know that someone mentioned that. The Depo-Provera is a shot that you take every 3 months, and main thing, it stops you from ovulating, but it also gives you irregular cycles. So it's opposite of the IUD and the birth control pills. You can have irregular bleeding, and it can be anywhere from a little heavier. Most times it gets lighter. The key is that it's irregular, so you may not be able to really put on a calendar and know when your cycle is going to be. So you want to keep that in mind in terms of the medicine that you use. The benefit of the shot is you get it every 3 months, and then you're good. You don't have to worry about a patch, a pill, anything. You just get your shot and you're good to go. Side effects that women will come and complain about and that we know about, you can have some weight gain. So you can have 10 to 20 pounds on this pill because the progesterone by itself is an appetite, it increases your appetite. So you're eating a lot more, and so you can gain weight on that. So, hey, Dr. Carla, Nexplanon, we're going to talk about that next. That's in my category. So, with the Depo-Provera shot, you have to think about the weight gain. Some ladies will notice hair loss. Not everybody, but those are the main two complaints that I hear about. And myself, as a doctor, we also have to think about bone density. So, the bone density comes into play, and it's important because as you thin those bones out, if you have a fall, you are have a higher chance of having a fracture. So when we see our older ladies and they fall on that ice and they break their hip, that's because their bones have thinned out just from getting older. But we also notice that on the Depo-Provera shot, you can have that thinning, decreased bone density. So we have to be careful with that. So after you've been on it for a year, we usually will add estrogen to it to help protect your bones. Hey, Dr. Darren, haven't seen you in a while. So that's with the shot. It's a great shot in terms of not really having to worry about thinking about something every day, but it has some side effects that you want to keep in mind and talk to your doctor, nurse practitioner, midwife about it if that's something that you choose. Now, the next one that falls into that category is, the brand name is Nexplanon. It used to be Implanon, it's Nexplanon. Back in the day, it was a Norplant, and I'm probably dating myself with that, but that's what we used to call it. So it's basically it's very small. It's about the size of a matchbook, and we put it here right in your arm here, right at the bottom, right kind of on the underside of it. It's so small that you really shouldn't notice it. We're putting it into the fat part of your arm. If you're really muscular, you know, it still should be something that's inconspicuous. But we put it there, and you can place it for 3 years. But because it's a high-dose progesterone, same effect as the Depo-Provera. You can have that irregular bleeding with that. So that's something you want to pay attention to. If it's really a problem for it, we can remove it. But those specifically have to be placed and removed by your doctor or your provider that's trained for that. So in terms of Dr. Carla, whether I like it or not, it really depends on my patient. It depends on whether she is someone who will remember to take the other alternatives, or whether a lot of times my younger girls will use it because they're in school or they're busy and I don't want them to get pregnant, but the other options haven't worked for them. Hey, Dr. Donna. Hey, Nicole. Hey, LaTanya. So that is something, the Depo-Provera shot and the implantables are the ones we use a lot of times for my younger girls. But again, we have to worry about the irregular bleeding. And really, if you talk to your patients or you talk to your doctor about it and you know that that's a possibility, then ladies can tolerate it a little better. Now, I just remembered another thing that I want to talk to you all about, and I'll get to it at the end. So those are our injectables and the Depo-Provera shot. Now, I want to talk to you all about condoms. All right, we kind of overlook the condoms, but the condoms are there, and we need to really focus on that as well because they're very easy to get, and a lot of times men and women will keep it on so keep it on our person and our purse, or hopefully not too long in the wallet. But the condoms are there, and you place it over erect penis. You use it with each use, and then you get rid of the condom. It's important when you place it on the penis that you leave a little space at the top, because if you don't, you increase your risk of that condom breaking or rupturing, or even the semen can come towards at the top of the base of the penis, and you can still get pregnant of that. Those sperm are really determined, ladies. So you got to make sure you're using that condom right, otherwise you will still get pregnant. There is a female condom out there. I guess we didn't have enough options, ladies, so they gave us a condom too. So the female condom it's a little sheath. It has the back of it, and then it goes into the vagina, and the opening has a little flap that you can put over the outside of vagina. You have to be careful that you keep it in place during the festivities. It really hasn't taken off that well, but for sake of completeness, I have included the female condom. So let me make sure. So now also, other options that are out there, and these are available without a doctor's prescription, specifically the sponge. So you have a contraceptive sponge and you have a contraceptive cap. And a lot of times those are used in conjunction with spermicide. Hey, Jason. A spermicide gel or something that you're using it with. Most of the times you want to place it about 6 hours before you are actively having intercourse, and you can leave it in up to 24 hours after you finish. So that's kind of where we're at with that. That is another option, the sponge and the cervical cap. Now, what I also want to let people know about is emergency contraception, because that's also important. Emergency contraception, a lot of times we'll know that as the morning after pill, but it's important to know that you can use that contraception, emergency contraception, up to 5 days. The best time to use it is 3 days after that act that you're not sure about, but it can be effective up to 5 days. The efficacy or how well it keeps you from being pregnant decreases a little bit, but let's say if you use it within 3 days, I want to say it's about 85 to 90%. I got my numbers here. That's what I'm looking at. And so if you wait until 5 days, it's a little less than that. But it's something to remember, because we all miss a pill or the condom ruptures. That's something that you can use in lieu of being afraid over the next month about whether your pill whether you're going to be pregnant or not. So the brand name, they have a number of brand names, is usually Plan B, and they call it one-step Plan B now because it's just one pill. But there are a lot of other ones that are there. So if you call your pharmacy, first of all, call the pharmacy to see if they carry it. and then they should be able to give it to you. And most of the times, you don't need a prescription. Now, the other thing you need to know about is if you're on birth control pills can also act as a emergency contraception if you use enough of them. So another question is going to be, okay, so how many do I use? So I'm going to give you guys a website, because the website has a listing of most of the birth control pills, the brand names that are out there that you can use. Look up your pill and it'll tell you how many you need to take. Now, you got to be careful because you can get nauseous with this. So pay attention to that as well. So the website is called www.nottolate. And I'm going to kind of spell it out for you. www.not-late.com. So www.no2-late.com, and that you can look up your birth control pills and it will tell you how many you need to take for it to be as effective as emergency contraception. So that's pretty much it, guys. That is pretty much most of the birth control options that we have out here. I'm looking through my little cheat sheet, and yes, that is it. So please like my page, Dr. Dawn. I'm getting my website together, Dr. Dawn OBGYN. If you like this talk, like it here on Facebook, and please follow me, because I'm on Twitter, I'm on Instagram, and I'm going to be doing some more Facebook Lives. So I want you to, if this is something that you want to continue, and I'm thinking yes, drop me by message or even here some topics that you want to talk about. I have a lot of buddies who've already given me some good topics. So I got 3 or 4 that I'm already working on. But just to be inclusive, I want to make sure that if you're watching and there's something you want to have more information about, let me know. And I'd be happy to help you. Again, this is Dr. Dawn. I am here on Facebook Live talking to you about things that I think you will want to know. I also speak to large groups. So I speak to churches and to different organizations. So if you want to contact me, just hit me up or give me a message on Facebook, and I'd be happy to set something up with you. Again, Dr. Dawn, thanks for hanging out with me, and we'll do this again soon. All right, guys.